Good morning, dear students. We have today a lecture on a topic which is associated with vaccines. One of the excellent vaccine that we have is called as DPT vaccine. This is a very basic vaccine that has been given to infants, and it is against three particular kind of diseases. It is the combination of three mixture of vaccines: diphtheria, pertussis, and tetanus. Now, first of all, let us understand the organism. So, the organism is Corynebacterium diphtheria, aerobic, gram-positive bacillus, typical shape in granules, distinguishing features from normal diphtheroids, toxin productions and relations with phage infections. See here, you can see the shape of this particular bacterium. A small dot-like projection is always there into this particular organism. Reservoir, human carriers, usually asymptomatic transmission, aerosol, droplets, skin lesions. Temporal pattern, winter and spring, and communicability usual to several weeks without antibiotics. So this is an organism which is going to be quite dangerous. It happens for a long period of time. So what are the clinical features? Incubation period 2 to 5 days, range 1 to 10 days. Based on site of infection, anterior nasal, ocular, pharyngo-tonsillar, laryngeal, cutaneous, and genital. So these are all different sites where the infection would occur. Indigenous onset, exudate spreads between 2 to 3 days and may form adherent in the membrane. Pseudomembranes finally in bacteria and inflammatory cells, no lipids usually occurs, not high but patient appears toxic. Differential diagnosis. See, tonsillar diphtheria would occur if you see this white portion. This white portion is nothing but that particular infection of the diphtheria inside the mouth of a particular individual. So most attributed to toxins, severity generally related to the extent of local disease. Most common complications: myocarditis, second week, neuritis, third week, and death occurs in 5 to 10 days for respiratory disease. So this is not a very simple kind of disease which is associated with the respiratory tract or the infection in the throat. For example, if tonsillar diphtheria would occur, then that particular patient may suffer from infectivity towards the lungs. Again, the patient may have a disability for responding in a very proper manner, and therefore the patient may go into such kind of conditions called as myocarditis or neuritis, means ultimately myocardial infrastructure mode takes place because of deficiency of oxygen that has been provided to the lungs. The reaction would be there and ultimately the patient would die. Or neuritis, certain neurological complications may occur to that particular patients, wherein the deficiency of oxygen to the brain would occur and the patient may go in coma as well. If the infection is untreated for a long period of time, or it has been prolonged for a long period of time, then death will occur in 5 to 10% for respiratory diseases. So primary infection would be inside the lungs, and ultimately because of that infection, certain primary other secondary infection would occur and the infectivity would go inside the lungs and the lungs are infected and the patient is unable to respire in a proper manner, and death would occur in 5 to 10% if the patient is not properly treated. See this 10-year boy with severe diphtheria, conjunctivitis, pharyngeal membranes, bull neck, severe myocarditis, and all vaccine contraindicated. See here, if you see the patient here in a very normal way he is, and when he is suffering from diphtheria, conjunctivitis, infection to the eyes would take place, conjunctiva. Second, pharyngeal membranes, bull neck. See the level of the neck. See here, if you could see this particular part, the neck, the chin, and everything goes on in a very higher manner. The infection would take place inside the throat, and the level of infectivity would be very high. Severe myocarditis and vaccine conjunctivitis means ultimately maximum vaccines if again been given, then again the patient is unable to recover in a very proper manner. So diphtheria vaccines, detoxified bacterial protein toxin, injectable, IM administration. Toxigenic, Corynebacterium diphtheria infected with beta phages, neutralizes only unbound toxins. Lifetime of antibody 15 days to 3 weeks, wait to 3-4 weeks before giving toxoid, only given once. So this is the way by which the administration of that particular diphtheria vaccine would take place. Manufacturing question: toxic strains of Corynebacterium diphtheria grow in Putin medium with the bovine extract. toxides by incubation with formaldehyde for several weeks, purified by precipitation, dialysis and sterile filter, absorbed an aluminum hydroxide. Diagnosis: Albert staining, smear and culture, modified light text, rapid ER. Yeah. So this is the most important part. Role of antibiotics. Now, what sort of antibiotics can be given? ADS. 14 days course of benzyl penicillin would be more preferable for such kind of patients which are undergoing an infecting with this. Repeat swab and RX. Management of care: benzethionine penicillin. Management of contracts: erythromycins. Based on the BP of the particular patient, one can easily diagnose the proper level of infectivity and the patient can easily be cured. Now, adverse reaction, local reaction, erythema and indurations means ultimately there may be some kind of redness that would occur, and because of that redness, the patient may have some infectivity. Irrigated local reaction, arthritis type of reactions, and fever and systemic symptoms are not common. Severe systematic reactions are also being present over there. So, diphtheria may have the level of infectivity will be high, and if the patient suffers from a long period of time, he may have certain other kind of complications which are related with this. Correct? So, we'll stop there for today. Next period, we'll try to continue with diphtheria. Thank you.